Hello, my name is John Bartolozzi. I am the Cardiology Director here at St. Mary's Regional Medical Center in Enid, Oklahoma. I finished my fellowship at Mizzou in 1994, and I've been practicing interventional cardiology since that time. The scope of my practice is everything. I do interventional cardiologist. I also do pacemakers, defibrillators, peripheral studies, as well as we have a large heart failure patient population, and we have an outpatient inotrope infusion program that has been ongoing at this facility for 22 years to help end-stage congestive heart failure patients live a little better life, better quality of life. Here at St. Mary's, I've been trying to move a program forward. As far as our cath lab services are concerned, we do different types of devices. As far as pacemakers, the micro that I spoke about earlier, CRT, biventricular ICDs. We also have an aggressive interventional cardiology program. It's a freestanding cath lab, but within the constraints set forth by the ACC, we do quite a bit of aggressive interventional procedures, and that being stents, both in the heart and also in the peripheral vasculature and the legs and stuff. And we have vascular physicians that come to this facility as well to help and do the peripheral studies and interventions. Our interventional capabilities, we have all the latest coronary stents, which are all drug-eluting now. We even have the Abbott stent, which you only have to use aspirin Plavix combination for 30 days. We also have just added to our shelf the Shockwave catheter, which we utilize in calcified lesions in the coronary arteries and in the peripheral arteries, and it loosens the calcium so we can get a better result when we use stents or balloons in those situations. We also have the Penumbra catheter, which we can use both in the coronaries and in the periphery to suck out blood clots out of the vasculature if we need to use that. We've got some other modalities that are coming next year that we're excited about. We'll talk about those later. So here at St. Mary's, the Micra is a Medtronic product, and we are able to offer that product here at this facility, and actually here recently have implanted several of the devices. It is placed in the right ventricle, in the trabeculae. There's no wires, there's no generator under the skin, and it works. It functions very well, and we offer that here besides just the regular pacemakers that you're probably familiar with, the defibrillators, and also CRT, cardiac resynchronization therapy, the biventricular ICDs. We also implant those here as well. Part of our cardiology program is our imaging program, our non-invasive imaging program that is echocardiography and CT angiography and MRI. We just recently acquired echocardiographic technology called speckle tracing or tracking. And what that is looking at the myofibers in the heart muscle, and we get a value called a global longitudinal strain, or GLS. It helps us screening population for cardiomyopathies and stuff. We can also screen people or use it to follow people with conditions like diabetes, hypertension, kidney disease, cancer patients receiving chemotherapy. We can detect problems with the heart muscle before it's even clinically evident on a regular echocardiogram or the patient becomes symptomatic. So this is a fantastic diagnostic modality that we offer here. The other thing I'm excited about is that we will have cardiac MRI at this facility in the next 6 to 9 months, and that is going to drastically improve our diagnostic capabilities as far as cardiac conditions are concerned. We're either going to be the 3rd or 4th hospital in the state to have cardiac MRI. So it's not a widely utilized diagnostic tool, but we will have that here to provide this to patients to diagnose different kinds of cardiac diseases. One other service that we offer at St. Mary's here in Enid, which is unique in the state, is we have an outpatient intermittent inotrope infusion program for end-stage congestive heart failure patients. These patients would be ones that maximum medical therapy as far as oral medications are concerned, and they need something more to help with their quality of life. That's where this program comes into play. We give an intravenous medication called milrinone that improves patients' quality of life, maybe adds some longevity, reduces hospitalization for heart failure episodes or exacerbations, and it's staffed by critical care nurses. We've had this program again for 22 years, and we have very good results with these types of patients. Overall, for this area, for the patients that we see, I mean, if you're experiencing chest discomfort, whether it's squeezing, tightness, heaviness, pressure, palpitations, you're feeling dizzy, lightheaded, or passing out, feet are swelling, you can't walk as far without getting short of breath, you have to sit up in bed to breathe, symptoms like that, those are the kind of patients, and we'll be happy to assist you in your needs.